You're listening to What Do You Know on Newstalk KGVO, AM 1290 and 98.3 FM.
Arnie, good morning to you. How are you?
Good morning, Scott. I feel like Matt Damon in the movie The Martian, where he's keeping track of how many days he's been on Mars before he was rescued. You know, we're now 6 months roughly into the COVID pandemic and all of its implications and, you know, consequences, intended and unintended.
Right.
It sort of dwarfs everything else. You can't plan much for the future. Usually this time of year, there's trips, there's air flights, there's other things that you would be doing, and you just can't do it.
It's incredible.
Here in Montana, we've seen cases increase. At one point, we had the lowest in the country. I don't know if we have the lowest anymore, but we've had 65 deaths. You know, at one point we were at 10 or 12. 55 of these deaths have come in the last month or 6 weeks. We're seeing more cases, and luckily we only have one death in Missoula, but we have almost 300 cases in Missoula, and we're sort of getting it after that sort of old data, because new people are going through their incubation period, so to speak. So we don't really know where we're headed, and it's having a devastating effect both here and around the world. I mean, there's only a handful of countries we can even travel to. You talk about being nationalistic. This is the perfect time to be nationalistic because you can't go anywhere. My nephew just got stationed in Wiesbaden, Germany, for the army. He's a dentist, and so his wife and his 2 kids went over there. They have to quarantine for 14 days. They're only allowed out of their room for about 15 minutes every 2 hours, just to get fresh air. That's what we face. Almost in every developed country in the world. We are now, the country that no one wants to let cross their borders. We have 4% of the world's population. We have 25% of the COVID cases and 25% of the deaths.
What's so interesting about this is you think back to the presidential debates towards the end of last year and the beginning of this year, everything that Bernie and Elizabeth were talking about, boy, do we wish we had that. Meaning we wish we had better health care. We wish more, public health care. We wish we had an economy that took care of people more collectively. And as opposed to us closing our borders on people, they're closing them on us. So the tables have turned.
Right, we are not the shining light on the hill anymore.
Not at all.
We're not the exemplar nation anymore, given the way we've handled this. And I throw it directly at the feet of the federal government. This requires a federal strategy. It requires a federal response. The countries in the world that took this serious from the very beginning and shut everything down and was serious about it have recovered and are back operating, almost to a country.
Well, look, our guests today are Tino Sonora from the University of Montana and Cindy Farr from the city and county of Missoula. And
they'll have some good information. They've been both doing an excellent job. Missoula is way ahead of the curve on handling this as good as any local community could handle it.
100% agree. Looking forward to it. Back after this break with Tino Sonora and Cindy Farr. We are back with our guests, Dr. Tino Sonora, who is the Associate Director and Director of Health Research at the Bureau of Business and Economic Research at the University of Montana, and our other guest, Cindy Farr, who is the Incident Commander for the COVID-19 response for the Missoula City and County Health Department. Welcome to both of you.
Thank you for the invitation.
Thanks for having us.
So we are 6 months roughly into this COVID pandemic situation. And every day it seems when you wake up in the morning, you kind of go and check, what are the numbers. There's a chart that comes right up on my phone. How many more cases in Montana? How many more cases in the United States? How many cases, worldwide? How many people in the hospital? And then, of course, you take a look at the economic picture on this. So maybe we can first focus just for a couple of minutes on the economics of this, and then we can talk about the health side of it. And I will, defer to Tino on this. But let me just say in general, in January 2020, the unemployment rate in the U.S. was 3.6%. Montana was slightly better, I think, at 3.5%. Now, in August of 2020, the national unemployment rate is 11.1. Montana, I think, is doing about 4% better at 7.1% unemployment. The big news, I think, of the last few days, we're recording this midweek, first week of August. The big news is that for the second quarter of this year, the GDP lost 33% of its, contracted 33%. Even in the Great Depression from 1929 to 1932, the GDP only contracted 15%. Tino, what should we make of all of this?
Well, this is, I think last time we chatted, this thing had just started, if memory serves. And I think a lot of people sort of guesstimated that the GDP growth was going to contract pretty severely in the second quarter, as well as the first quarter. This second quarter contraction of about 33% is sort of an annualized quarterly rate. Some people are looking for it to rise over over the third quarter, which we're in right now, slightly, though that remains to be seen. But what's going on here is that in sort of response to the COVID, we had to use a really blunt instrument to try to get everything in check. And that was basically closing down the economy, and not only in the United States, but many places around the world as well. And that blunt instrument basically brought the economy to a standstill. And so you saw huge increases in, as you said, unemployment rates. Obviously, personal expenditures started to decline pretty precipitously, have declined very precipitously. That, of course, bleeds into investment decisions around the future. So there's a lot going on here. But this is one of, most economists would say this was the most predictable recession on history, because we knew exactly what was going to happen. We knew that once this was going to shut down, once we started closing businesses to try to get this thing in check, that we were going to have a recession. So I think in the early days when we spoke last time, I had just done some estimates of recessions, and I turned out to be right, as it turns out. But now here we are stuck. We're in this thing. We're going to potentially have protracted problems, because now we're still having the federal government's arguing about this extension of the CARES Act. The House of Representatives passed the HEROES Act, of course, about 2 or 3 months ago. And that's just been sitting on the desk. And now we're here once again at sort of the edge of the cliff, wondering if the House and the Senate can get together and pass another package to extend this unemployment insurance, which has gone away as of last week. And if that doesn't go through, then I think we can look forward to a much more protracted recession, on top of the uncertainty that people have about going out and doing what they have to do. So this is a very unfortunate time. I know that I just want to say one last thing, and then that unemployment claims, initial unemployment claims, came out today, and they have fallen, and in Montana as well. But if we look at continuing claims, that's still around, 15, 16 million people in continuing claims. And this discussion about whether or not, people, if they're given this unemployment insurance, if they'll be willing to go back to work, is kind of a non-starter, because there's only 5 million jobs openings. I mean, so you've got 16 million people chasing 5 million jobs. Somebody's got to be unemployed. There's just no way around it. So we've got to, the only way we can kind of increase demand for employees is to try and get this economy kickstarted. So I think it would be, it's kind of we need to get this thing sorted out. sooner rather than later. And with the federal government basically borrowing at 0% interest, this is almost kind of a no-brainer.
I want to get back to some of the the economic implications. But Cindy, incident commander, before we talk about what's fueling this, which is COVID cases and COVID illness, what is an incident commander? Sounds like a very important title, and I'm sure it is. I've never had one like that. So what does an incident commander do?
Yeah, so when we are in a health crisis or an outbreak at the health department, we use the ICS structure, incident command structure, that came out of FEMA and NIMS, essentially to structure our personnel so that we have the ability to increase our response or decrease our response as needed. It's used a lot in wildland fire and, some other incidents like that. That's where it came from, was wildland fire. And so as the incident commander, I'm at the top of that chain, and I have my command staff, and they all have different functions. And so I've got my PIO, who typically sets up my media requests and, puts out my press briefings and stuff like that. And then I've got my deputy incident commander, which is Ellen Leahy, who's also our health officer. We've got a logistics chief who makes sure that they're ordering all of our supplies and keeping us supplied with everything that we need, including personnel. And we've got operations, which is the biggest section under us. And we've got, I want to say, more than 80 people working in that section right now. And that includes our testing branch. That includes contact tracing and case investigation. It includes all patient services, call center, all of that stuff. We also have our plan section, who keeps us kind of on track with our plans, and safety, who makes sure that we're all staying really safe through this whole incident. So that's essentially my job, is to make the executive decisions, approve anything that is going out publicly, and really work with our team to do the best that we can to control this outbreak.
So Missoula has 291 reported cases, roughly, as we're recording, and 1 death. I think statewide there have been 65 deaths and about 4,500 cases. How are we doing in general? How's our plan in Montana working?
So we believe that we're doing pretty good. We did have further restrictions than most of the other counties in the state, because that's what me and our health officer and the rest of our team feel are the things that we need to do to protect our community from the spread of COVID-19. And that has kept our numbers really manageable. We are still seeing an increase in cases, but we knew that that was what was going to happen as we started the phased reopening and people started being around each other more. We expected to see an increase in cases. And what we're trying to do is just make sure that that case increase doesn't exceed our capacity to control it. And primarily, we're really keeping an eye on our healthcare infrastructure, because we are a healthcare hub and serve many counties in Montana and not just Missoula. And so we have to keep a really close eye on how it's impacting our healthcare infrastructure to make sure that we're not overwhelming our hospitals, so that if somebody does get sick and they need treatment, that they can get the treatment that they need so that they can recover from the disease, as well as other things that are going to continue to happen, like car accidents and heart attacks and strokes.
Globally, there's been about 19 million cases and 700,000 deaths. So we're always focused locally on what's happening in Missoula and Montana and even the United States. But the U.S. is 4% of the world's population. We roughly have 25% of the cases and roughly 25% or so of the deaths. Does anybody want to take a stab at why is that? Why are we in that situation?
Well, from my public health perspective, I can tell you that part of the reason that we are in that situation is that we do not have a national strategy for controlling this disease. A lot of other countries have taken a more nationalized approach to how it's going to be controlled, but in the United States, it's up to every state, and in some states like Montana, it's up to every county how you are going to control in your own communities, compared to other places where they really have a national strategy that comes down from the top, and then the public health side just implements that national strategy.
Yeah, and because you don't have a national strategy, you have a situation like earlier this week, I saw some photographs from the Sturgis motorcycle extravaganza, and they had pictures of 250,000 people gathered for sort of this opening, and there wasn't a mask in the crowd. What's that going to do, Cindy, when those people go back home? I mean, it's impossible to think you could have 250,000 people from around the country gathered in one place in that kind of close proximity for 2 or 3 days and not have some kind of eruption.
Yes, we fully expect anytime that there's a huge event like that, it's going to impact not only the community where they are holding the event, but also the community where people are returning to, as well as those communities like our own, where people are passing through on the way to and from that event. Because, we know that with this disease, you have up to anywhere from 2 to 14-day incubation period. You could be contagious for 2 days before you ever have symptoms. And so as those people are passing through Missoula, then, we can certainly expect that we are going to likely see an uptick in cases.
Tino, you're doing health research and looking at health policy. And Cindy just mentioned we don't have a national strategy. And we didn't have one at the beginning. We're 6 months into it now. We still don't have a national strategy. What's the holdup, and what's going to be the outcome of this if we never have a national strategy?
Well, I think, not being a political scientist, just looking at it as a layman, obviously we have a lot of politicization of this whole thing, which is really been problematic in coming up with a cohesive strategy for this. It's not, and it's also sort of centered in, we can't let the economy die. I mean, that's basically been the sort of underlying premise. So you've got these two forces, which have just created a situation, an environment whereby coming up with a cohesive strategy is just not viable. And part of that has to do, of course, again, I'm not political science, part of this has to do with our style of government, a federal government, which is basically a state government. That the federal government has only control over some things in practice. Of course, when you have a health emergency, this type of issue is the federation just doesn't work. I mean, as Cindy alluded to, it's like if we could have an event somewhere else, South Dakota or North Dakota or Florida or wherever, health is a public good, meaning that we all consume it simultaneously. So, I don't know what the R naught is. It's something like 2 to 5 or something on this thing, which is how much this thing transmits. One infected person can infect a lot of people. So now suddenly, without a national strategy of this idea, this sort of environment whereby somebody can just walk around and spread this disease around to many people. So the analogy for this is something like a television, right? If I'm watching TV, I don't necessarily prevent you from watching TV. So the good itself, the TV program itself, can be consumed by many, many different people. Same thing with health. And so by not having this sort of national strategy, you have a situation whereby these quote unquote externalities, these things that are outside of any individual's control, can have an impact on them. And so that's what we're dealing with. And I was in Idaho a few days ago, and there is no mask requirement there. So it's kind of a shock after you've been here in Missoula, which I think has done a really good job. Just again watching the numbers on a daily basis. To go somewhere else, it's sort of shocking. And I didn't see the Sturgis thing, but I did see something of a school in Georgia outside of Atlanta where the kids are all piled into a hallway with and not a mask in sight too. So, and they're having an explosion. You think they'd be very on the forefront of a lot of people's minds. And what this is going to have an impact on is not necessarily today, but in the future, because again, if all of these people get sick, then suddenly we have to shut everything down again. And then we're put into a situation where the long-term losses are certainly going to sort of outweigh the short-term costs that we're just or gains that we're having by opening up the economy. Because if we do have to shut it down again, as some states are doing, right, and certainly Melbourne in Australia has just done it. That's going to be very, very problematic over time. So I think we're looking at a good 18 months to 24 months where we're going to sort of keep seeing this unless we kind of get a good grip on this, or when the vaccine becomes, I should say, universally available, not just available, but universally available.
let's do a quick ID. Our guests are Tino Sonora from the University of Montana and soon to come back, Cindy Farr from the city and county of Missoula. Tino, you had brought up early in your initial kind of, part of the interview about unemployment and about just all, it really opens up the door for all the incidences or things that have happened because of COVID, unemployment, other, neglected health for people that have chronic issues or have undiagnosed issues. And I wonder what the impact of that is on the economy.
Well, I think, there's been quite a few commentators that said something to the fact that, and we've had this discussion before, that a lot of our social safety nets are essentially torn. I mean, if I was a trapeze artist and our United States safety net was my net underneath me, I don't think I'd get on the trapeze. What this has done is really sort of shine a light. And I'm not the only one who believes this, is really shine a light on a lot of the shortcomings of our system. So, for example, with the unemployment insurance in Europe and many places around the world, when you become unemployed, you just wander down to your thing and say, hey, I'm unemployed. And then they give you a check. And they say, well, keep looking for a job and off you go. But here it was, you have to file for it with the state. Then they have to double check. And so there's this huge rigmarole, this huge costs that are sort of confront the unemployed person to even just get unemployment insurance. It's not an automatic thing. And then you have to keep reapplying for it. And of course, it's fine when there's only 12 people applying for unemployment insurance, but when you've got thousands and thousands and thousands applying and people are still waiting for some of their checks, in some parts of the country, then the system doesn't work in this type of situation. And I understand sort of the idea behind not getting it too easy. It creates what we refer to as moral hazard. It creates an incentive, and this is what a lot of the Senate side of this, the Republican side of the Senate is saying, and this is true, is it creates a sort of disincentive from working. But on the other hand, when you have a situation like this where there are no jobs, and for whatever reason, it just doesn't work. And likewise with the health system. I mean, our health system is. Words can't. I can't even put words to what it is.
Let me ask you this, Tino.
Yeah,
you've done a lot of economic analysis and health research analysis. I've never seen a situation like this where there is such a substantial group of deniers, essentially, that are out there that say it's just a flu and you're not going to really get it, and there's no greater chance of getting this than getting hit by lightning and all of that sort of thing. So one question is, what would have happened if we did nothing? If we didn't shut anything down, we just kept business as usual, that whole kind of herd immunity idea. What would we be looking at right now?
Well, I mean, no one knows, right? No one has an answer. I mean, the closest we can come to is look at the experience of Sweden, which they did basically nothing. And they said, we're going to achieve herd immunity, and we're just going to keep the economy rolling along. And it worked for a while. But now they're running into issues again with the growth of this thing. And so that could have just delayed the decline in the economy, I suspect is what's going to happen. Or would have happened, is that and Japan's experiencing the same thing too. And now Japan's starting to shut down. They kind of took a very laissez-faire approach to this thing. And now cases are spiking, and now they're starting having to backpedal and tread water and try and figure out what's the best course of action going forward. So the answer is, no one really knows, and I don't know. People think have a pretty decent idea that that's probably what would have happened in the law over time. I think another thing that's important to note about places like Japan and Sweden and some of these, Taiwan, for example, is they're much more homogeneous societies. They're much more have much more national identity than I think the United States does. And certainly over the past 20, 30, 40 years, as you well know, we have this growing divide between, and racially, income-wise, I mean, on all scopes, the inequalities or I don't want to say inequalities, but divisions are rising politically.
I mean, it's like we have
that sense of unity that would sort of say this rallying cry. And I'll just give you a quick example. During the Asian financial crisis of the mid-1990s, Korean foreign debt started to spiral out of control. And what the Korean government basically did was asked the residents, the citizens of South Korea, to give them money to get South Korea out of this debt crisis. And people were like pulling out their gold teeth and donating it to the government to help pull themselves out of that crisis. And something like that kind of national unity, I don't think could ever exist here. So that's part of that. I mean, there's so many dynamics we could talk about this for the next 7 years, probably. There's so many dynamics going on here that I don't, that's just what makes all this uncertainty all the larger.
Well, it's pointed out to me and to some other people that we really are not one country. We're more like 12 countries, overall. And these regional differences are very strong. Cindy, we were just sort of chatting about this issue, and maybe we can put it to bed once and for all. This whole issue of the denial of this is just a flu, and people get not any more sick, and there's just as many people that die from the flu, that die from corona, and we should just kind of treat it like that. For once and for all, this is not just like the flu.
No, this is absolutely not just like the flu. There is some sort of misconception out there that the flu kills 300,000 people a year. For the 2019-2020 flu season last year, the estimates of deaths from flu is 23,000 to 64,000 people died from the flu during that flu season. And we have now had significantly more deaths from COVID-19 than that. And so, yes, I believe that people should take this seriously. It definitely makes a huge difference if people are taking it seriously and doing all of those precautions, as we've seen in lots of places that, people are putting in precautions, then there are less people dying.
Right. And it gets back to, Scott, we were just talking about, there are people who just ignore the precautions. There are people that are willing to put a mask on to go hunting. There are people that are willing to put seatbelts on all the time because there's, they've gotten used to it. But there are people who just completely refuse to engage in safe behavior. And, we've never seen that in this country to the extent. Sure, there are anti-vaxxers and there are some other people that resist, proven science. But in this case, the reaction, as shown by Sturgis and as shown by the Georgia school situation, or Texas lieutenant governor basically saying if kids get sick at school, they could just go home. I mean, it's just sort of the most anti-science and anti-factual, reaction, pushback that I've ever seen. And Tino, why is that?
Why is that?
Why do we see so much of that in this? Has it sort of become the rallying cry for lots of other kinds of issues?
I don't. Again, I'm not a political scientist, so I can only report. Talk to what I've read because I'm trying to figure it out too. And Cindy could probably speak to this more than I can, but there's been similar like anti-mask things in previous pandemics. I think there was a big anti-mask. We don't believe the science kind of thing during the 1918 Spanish flu pandemic as well. So, this is not something that's new. This is kind of the same thing's been going on. Part of that I think has to do with sort of the American ethos of we are free and we can do what we want and we have these rights that are this pursuit of happiness and it's very sort of in a way very sort of self-centered and I think that what we sort of end up losing is that my happiness can actually benefit your happiness too and vice versa, or and that's what I was talking about earlier about these externalities is you when somebody is ill and refuses to wear a mask, it's not just an impact on them. I mean, I don't wear a mask, no one's wearing a mask to protect them from you. It's from somebody else. It's always about protecting others from yourself.
Well,
I was going to say that's kind of that national unity thing,
Yeah, the lack of national strategy. A friend of mine lives in Italy, and when this started hitting hard Italy, they just adopted you have to stay at home. If you're caught out of your home, it's a €500 fine. Period. In Singapore, if you don't do a 14-day when you come back to the country, or if you don't do a 14-day isolation, you walk out of the facility that you're in, you put in jail. And they have very little incident.
That's amazing. Cindy, I'm actually curious to know, how is our adoption of masks as a county and as a city compared to, let's say, Gallatin County or some of the other counties where there's been a higher incidence of cases?
So we adopted the mask rule through the Board of Health and the health officer orders before the governor put in the mandate that everyone in the state needed to wear masks. I'm not sure how much it's being enforced in other counties. I can tell you that here we take it seriously. We've got an entire enforcement team at our health department that when they get complaints about a business who's not enforcing the mask rule, that they actually go out and visit with that business and they educate them on why this is in place. And, you know, when it comes to other counties, I'm not sure how much they're actually doing that. I can tell you that, you know, we ramped up our response really fast. We basically had our response in place before we ever got our first cases in the United States because we had a feeling it was going to come here. And so we prepared really early here in Missoula County. And we also are not afraid to take those really hard steps that are going to protect the public that some people are just really not going to like. And I think that some of that, you know, we're just handling it differently here in Missoula.
Well, we're in the midst of tourist season. I noticed New York City, which had 3 consecutive days this week with no deaths, are putting up checkpoints for cars that are coming into the city and are checking out-of-staters. We have a lot of out-of-staters. I've been looking around town, and when I'm stopped near a motel, I just out of curiosity look to see what the license plates look like, and they're from all over the place. How is that affecting us at this point?
Well, you know, we don't have any solid proof that people from out of state are actually bringing it to Montana. And some of the things that we are actually seeing at this point is that we are seeing clusters of cases. And so that tells us that we're giving it to each other. We're definitely giving it to our family, friends, our coworkers in settings such as family reunions, weddings, funerals, workplaces. But that said, you know, we had a long time without any cases. And then as soon as there was no longer a 14-day quarantine in place for people coming from out of state, we made it exactly 1 incubation period of the virus, and we started having cases again. And so it was brought back into our state from people that were coming in, but now we're all spreading it to each other.
Well, a good example of that was what happened down at Big Sky. They're building a new resort there. They're building a Montage resort at Spanish Peaks. And a lot of the construction workers are bussed in to the site from Bozeman and from the surrounding areas because the construction worker population in Big Sky is not very substantial. And there were 116 of the workers that tested positive for COVID. And I'm sure that was not only because they were together on the work site, but compounding that was they were taking buses to the site. And I can't tell whether they were wearing masks or not, but knowing that particular subset of the demographics, I would think that they probably weren't abiding by the mask rule to the extent they should. So I think it's very important to point that out, Cindy, to our listeners, that these group events, 40, 50 people, at a picnic somewhere, all these large summer gatherings at Flathead Lake are going to lead to an increased incident. We have to try to figure out, how to contain that.
Yeah, we like to point out to the public that, while the governor's orders and directives and our local orders and directives say that it's okay to have 50 people without social distancing, that doesn't mean that you should do it. If you can still practice social distancing, it's going to cut down on our incidence of disease.
Cindy,
the other thing I'd like to add to that part of the conversation is that people think that it's either the economy or health, and it really needs to be both. It has to be both the economy and health, because if the more people who get sick, that puts those people out of commission. They can't work. They've exposed all of their coworkers. So now the business has to close down. So really, it needs to be a combination of both economy and health in order to get through the pandemic without either of them having to be majorly sacrificed. Is that, that's why we encourage businesses to come up with a plan to keep their employees separated from each other, because we've seen it in Missoula and all across the country that, one or two employees get sick and they've exposed everybody in their workplace, then that business has to close because they can no longer operate. Right. So people really should stop trying to think of it as one or the other. It really needs to be both.
Right. This is a lot to me like drinking and driving, right? Somebody might say, well, I can handle a beer, but we're not worried about you. We're worried about your car swerving into somebody else and killing innocent people. And, that's sort of what we're facing now. Cindy, I'm not a doctor, although I play one on the radio very often. There seems to me to be, from the literature I've read, sort of a viral loading element to this, which means the more people you are around that may have it, like in the crowd environments, the more ill you might get. I've noticed that from some of the things where, a perfectly healthy 35-year-old doctor in an emergency room seeing 30, 40 patients a day dies from it, when somebody who may come in contact with just one person, has more mild effects. What's your thoughts on that?
Yeah, I truly believe that more research needs to come out about this, but the research that's coming out right now and what we're seeing anecdotally, like the situation you just described, is telling us that the more people that you're around who are sick, the sicker you're going to get if and when you catch it, compared to if you're only around one person who's sick. It does have a viral loading component. The other thing that really lends itself to that area of research is if you look at New York City, how many people were getting sick and dying for so many months. And, it's all about population density. If they leave their house, then they may come in contact with 5 or 6 or 10 people who were infected. Therefore, they're getting a more severe form of the disease, where in Missoula, if you leave your house to go to the grocery store, you can very easily only come in contact with one person. So, that is one thing we have going for us here in Montana.
Back after this break with Tino Sonora and Cindy Farr.
Hunter...
We are back with our guests, Dr. Tino Sonora, who is the Associate Director and Director of Health Research at the Bureau of Business and Economic Research at the University of Montana. And our other guest, Cindy Farr, who is the Incident Commander for the COVID-19 response for the Missoula City and County Health Department.
In the New York City area, there were 32,000 deaths, 10 times what died at 9/11. And I mean, you saw how the country responded to a 9/11 disaster in 2001. It just seems that there's such a schism between taking this 10 times more seriously than 9/11 and just shrugging your shoulders and saying, okay, we're going to send everybody back to school. What's been your conversations here locally, by the way, about kids in Missoula going back to public school?
So, two answers to your question, or just a comment on what you were saying about 9/11. To put it in perspective, the number of people that are dying of this disease every single day would be the equivalent of 50 full commercial passenger airlines crashing every single day and killing every single patient or every single patron that was on that airplane. So if we were to be looking at it like that, and that was what was happening, then the entire country would be in an uproar and be wanting to do everything they could to keep those planes from falling out of the sky. But because it's a disease, people just seem to look at it much differently than that. On the front of the schools, we are working very closely with the superintendents of the schools in Missoula, and we've been looking at a lot of data with them. I have weekly meetings with them where we talk about the data and we talk about, the R0. And right now, for people who don't know what the R0 is, that's the the number of people who become infected from one person who has the disease. And a week ago, our R0 was 0.9. So just less than one person would get infected if they came into contact with someone with the disease. This week, it's gone up to 1.04. And so we're seeing that steady increase. It's been steadily increasing since the beginning of June, which tells us that we have more disease in the community at this time. And that is one of the numbers that the school superintendents are looking at when they're determining how they're going to reopen schools. Each district has a little bit different plan for how they're going to reopen schools and whether they're going to go, start with remote learning or they're going to have staggered start times and smaller pods of students. But we've been trying to just work with them on all of the different things that they can do to prevent spread in a school setting. We do know that kids between the ages of 10 and 20 are just as infectious and can spread the disease just as easily as an adult. There's less known about kids that are under 10, but some of the things that they do know is that kids under 19 and under essentially have less severe forms of the disease than adults do, and sometimes it presents differently. So it might just present as they're just not a kid who naps and they really felt like they needed to take a nap and they got a little bit of a headache compared to adults who have the more severe forms of the illness. But because of that, kids aren't really getting tested in the numbers that adults are getting.
I think that's an important point. And I think the other important point on the health end of this, before we jump back into Tino taking a look at the economy, is people don't know. The scariest part for me is people don't know if they have underlying conditions. And this thing exacerbates underlying conditions that you might have. The liver produces the antibodies that fights this. And if you have certain kinds of underlying conditions, these antibodies go out and start attacking other parts of your body. And that's what's leading to, such a horrific death rate. But back to the economy. This thing keeps going on, Tino. We don't have a national strategy, which is crazy. We had a national strategy when there was one shoe bomb on a plane. And all of a sudden we have TSA and everybody has to go through this whole rigmarole because of one event. This is killing 180,000 people, 5 million cases, and we still don't have a national strategy. If this keeps lingering, what's going to happen to the economy? What's the economy going to look like? We're 6 months into this. What's it look like 6 months from now?
Well, I think we're ending, this is starting to sound a little bit sort of repetitive, but I think we're entering into a new normal. I think there's going to be a lot of change. I think there's going to be a fair amount of structural changes that are going to occur, just like happened after the financial crisis. Businesses are going to find that they can do more with less people. I mean, they're having to adjust right now to produce the same amount of goods with people being ill. I mean, if you think about, for example, the meatpacking business, where everybody was getting ill and we can still go get our chickens and what have you. There was a short-term shock whereby it was more difficult to get, but things have changed now. So that's going to be part of the longer-term effects, I think, is just the structural change in the economy. So, skills are going to become some skills may become irrelevant, or at least become much lower in demand. Other things that sort of what I'm hoping is that we have sort of a look at our social safety net system that we talked about earlier. I think that's something that's going to have to come up for some changes. I think it's ludicrous that, if I'm in Taiwan, I can go get a COVID test and they charge me 13 cents, whereas here, I can get charged anywhere from 13 cents to $10,000. So there's, and just finding out that so many people are losing their health insurance and what's that going to do? And as Cindy alluded to, absolutely, well, not alluded to, but stated, absolutely the health and the economy are intrinsically tied together. There's no way to separate them.
If an
Without people, you don't have an economy, and on both the supply and demand side. So
right, and if employers say no business travel till the end of the year, then what happens to the airline industry?
Exactly, and I mean, and there's some frustration here too. I think sort of Boeing got lucky, right? They're just in the middle of their whole Max 30 thing, and suddenly they have this excuse that they can get $500 million loan from the government because now they're not flying, so they can basically cover their jets and what have you.
They're over
during the Max. Yeah. I mean so that kind of helped them. I mean, they got lucky. but yeah, I mean, what we need, I think that's my great hope. And I think a lot of people hope here is that the United States economy starts rethinking how we are going to do not only healthcare, not only how we're going to do unemployment insurance, but I think another big piece of the puzzle that is severely lacking, and particularly for many working Americans, is childcare. And so, there's some evidence to suggest that people aren't going back to work, not because there's no jobs or not because they can, it's because who's going to take care of their kids? And now with this school thing, I mean, where do you stop? I mean, it's just, and then.
Sure. There's so many tentacles.
Yeah. And I'm thinking in a year or so, it's going to be a different world. I was talking with my wife last night about this, we didn't grow up before and after the Spanish pandemic, right? So what the world that we inherited was normal. So there's going to be a new normal for people that are growing up now. It's going to be the post-COVID world, right? The AC, what's 7 AC, that's the new normal. And how is that? We're able to sort of witness what that structural break is going to end up being, both to the economy, to our systems, to a number of things. And hopefully the way we view each other, rather than having this divisive thing, we need to start thinking about trying to put that to rest, because it's not constructive.
I was going to say, it also speaks to both you and Cindy, just the value and the knowledge that you bring to the community, and certainly beyond just our local community. I didn't think about our public health officials before March 16th of 2020. I knew Cindy, but I didn't think about her all that much, other than when I saw her, with her husband, et cetera, at Farsight Sign. But Cindy, and now not only do I know what Cindy does, but I realize what a value she provides to the community. As you, Tino,
plus Cindy's become a media star.
But she's and a knowledge base, exactly. But Tino too. I mean, it's think about it. Like, they're looking at our community and looking at our economy and how this is impacting it, and it's just incredible knowledge that we don't think about this sector or that sector and how it's performing, or that it has to be reimagined. And that's what's happening, right? This is shaking up everything. And with our final moments, what's the optimum for each of you? What would you like to see happen, 30, 60, 90 days out? What would you like to see happen?
Cindy?
I would love it if everybody would just believe that this is really a thing, and that the best thing that we can do to protect our world is to protect each other. And that means wearing a mask, staying 6 feet away from each other, staying home when you're sick. You'd be surprised how many people that we know that have tested positive that, I wasn't really feeling good, so I went to work for a couple of days before I stayed home. Stay home if you're sick. Keep your kids home if they're sick. And just care for your fellow human beings around you. That's the best thing that could happen, is that, we start really caring about each other and try and keep control of this virus.
Tino, last words?
Well, I mean, there's a short-term answer and a longer-term answer. The short-term answer is to keep the economy rolling and to allow people to recover from being sick, because that's a big piece of the puzzle. People are going to work because they have to. There's no 5 days of paid sick leave. I mean, that's already come and gone for many people. So in the short term, what we need to do from an economic standpoint is support the economy. I mean, Congress, the Senate has to get their act together and get this thing taken care of. We'll worry about the repercussions later down the road once this economy recovers. But until then, we have to do that. Longer term, I think we have to reimagine the social safety net, and we have to figure out so that people can, if they are feeling sick and they have to take 2 or 3 days off, they're not at risk of not putting food on the table at the same time. And that's something like 80% of Americans live basically paycheck to paycheck. And we need to come up with a better way of doing our economy, or our economy has to rethink. It doesn't have to be centrally planned, but as an economy as a whole has to rethink how can we get people so that they are not so susceptible and not so on the edge all of the time.
Those are good words to end by, Scott, don't you think?
I sure do. I mean, our guests were Tino Sonora from the University of Montana He is the Associate Director of Health Research with the Business School. And also Cindy Farr, who is the Incident Commander of COVID-19 response for the city and county of Missoula. We really appreciate you guys coming on with Arnie and I. Would you guys come back and give us an update again in a few more months?
Yeah, absolutely. Thanks for having us.
Yes, I absolutely, and hopefully we'll have better news to report.
Right. Hopefully this won't turn into the zombie apocalypse.
Hopefully we'll all still be alive, right?
Well, you're doing better than any of us right now, Tino, where you are. So,
you know it, right?
He's in a hidden location. Anyway, Arnie, I will see you next week. Thanks, folks.
Thank you for listening to What Do You Know?
I can't wait for the next show, Scott.
I'm excited too, Arnie. If you'd like to suggest a guest, send me an email at scottrichmond@townsquaremedia.com. We'll see you.
On Fridays, Montana